Hello, everyone. So this is Washington, D.C., city that loves power. What does power talk about? Money. Power always needs money. So we're going to talk about money today, but in the right kind of money. We're going to talk about revenue. I've been in blockchain 5 years, healthcare 35 years, and I've been listening for the last 5 years on the art of the possibilities. What blockchain will do, what the use cases are, when it's going to be deployed, it's going to be magical. It has a lot of potential, but I'm actually, frankly, tired of listening to the potential. Because we need to do something, guys. We need to actually bring business solution to market. So now I've been in commercial insurance, the hated CIO of the hated insurance companies. I've been in public programs, the hated CIO of the Medicare, Medicaid. I've been on the hated side for a long time. And the reason blockchain attracted me in the first place is exactly what Dino said a few minutes ago, that you can disassociate yourself from the project. You have to be able to show the users of the solution that you don't control the outcome, because if you do, they don't trust you. I've launched many diabetes care, pregnancy care solutions. I've launched many eligibility, enrollment, adjudication, payment systems. I've done a lot of Medicare contracts. Nobody trusts the system because we control it. Whoever we is, me or my former colleagues or my current colleagues, because we control the data, people don't use it. That's simple. I'll give you an example. I was appointed by the governor in one of the northern states to build the HIE. Remember, Health Information Exchanges? I had a $150 million budget. I spent $350. Got everybody to connect, all the hospitals, all the labs, all the clinics. In the end, nobody put the data on the HIE because they didn't trust the HIE because we were in charge of it. So the problem isn't technology. The problem is solution. What do you do with the technology? So I'm going to talk about what we need to do. So again, as I said, I'm tired of listening to the art of possibilities. Let's do the art of doing. So what I'm here to talk about is what will it take for us to actually launch solutions in the market? All right? Let's talk about some of you here are agencies or organizations that actually want solutions that work better than your current solutions. So what are you waiting for? Well, here's what you're waiting for. You're looking for a solution that you can relate to and that you can actually procure. You have to be able to procure something that's functional. Nobody buys technology. Nobody buys possibilities. Try to be a procurement agent who buys the art of possibility or out of the job in about a week, if you're lucky. So you need to have solutions, and we need to build solutions. So as GBA, and I talk to Gerard often about this, we need to start talking about productizing and delivering the value that we keep talking about. So I'm going to show you how you do that. So I'm going to introduce to you something called CareLabs. It's an environment that we built for people to build solutions. So the idea is that you don't sit and think about use cases, you bid on business. There are a lot of very familiar names, Deloitte, KPMG, Booz Allen Hamilton, Cognizant, KPMG. All of these guys make tremendous amount of revenue, more than the whole blockchain industry combined, right? You know, I have written many checks to these guys, 50 million, 100 million. Do you know how many zeros there are in 100 million? I don't. I can't figure it out. There was a time when I was leaving Blue Cross, my last day as a CIO. IBM flies in with a big jet, slides a paper across the table, kid you not, said, this is your new eligibility system quote. We are making you a deal before you leave. I flip it over, it's 129 million. It was actually a deal. I said, boys, get rid of a zero, any zero you like, because I'm paying 13 million maximum. I can't keep writing checks like this. I've written checks for $1 billion for websites that blew up on the first hour. We have all heard those stories in the media, right? Been there on the front lines, in the trenches, procuring and implementing those systems. They don't work because they're too centralized and they're too inflexible. So let's talk about what does the business actually want. You know what I want as a CIO? I want to fail fast. You know what that means? When my business comes to me and says, hey, Pradeep, why don't we try out a new pregnancy care model? We have this cool idea. We're going to launch a special benefit for all the pregnancies in the state of North Dakota, which are over 35, at risk. So we're going to go ahead and run a program for them. Can you give me this little thing through which they can enroll and through which they can submit their trimester reports, and we'll incentivize them with a lower premium if they just submit 4 reports to us. So we can intervene if something's gonna go wrong. Sounds pretty simple, right? So I go off to my favorite IT vendor, and I say, guys, we gotta do this pregnancy care system. They're like, okay, very good idea, like it, very cool. $3.2 million, 4 months, or 5 months, whatever. I'm like, no. I got 35 grand. I don't have $3.2 million. And I have 2 weeks. And like, nope, can't be done. So we didn't do it. And our premature birth rate didn't go down. Now, I'm not just an evil CIO. I don't have the tools to do the job, right? The next day, my chief medical officer walks in, value-based care. We're going to pay doctors for performance. I'm like, crap. We can't even pay our claims. You're talking about performance-based systems, so we're gonna have to put all these metrics in place. So we go to Tableau, and again, it's a $3 million, 6-month project. We try it, it fails. That's what happens. So I wanna fail quickly. So what I wanna challenge you to do is to go to the market with a fail-quick solution. And yes, blockchain is built in there, guys, but nobody buys blockchain. People buy solutions. So blockchain brings value, no doubt. If you've been to any blockchain conversation, you've heard it 1,000,000 times. Trustless, immutable, verifiable, decentralized. Who the hell cares? Show me the solution. Show me something I can show to my stakeholder. Show me something I can show to my board. Show me something I can show to my COO or CIO or whichever C-suite and say, I can do this for our client, whether the client is a patient, the doctor, the hospital, the nuclear physicist, I don't care. I can do something for you, and it's quick. And if it doesn't work, we'll waste 50 grand. Guys, 50 grand in the healthcare business, in the business I'm in, is not even lunch money, but 5 million is. And more importantly, I'm gonna get fired if I fail 2-3 times in a $5 million project. But if I fail on a $50,000 project, my board will say, good job, Pradeep. You figured out very quickly that this is not gonna work. There's gonna be something in between this and not working, but they're gonna know that I only spent 50 grand and I avoided spending 5 million. So the job of blockchain community, the GBA in particular, because you represent Government Blockchain Association, is to reduce my risk. So 3 things I want you to hear when I tell you as a former buyer of big IT systems. I wanna reduce my risk, I wanna fail quickly, and I want you to do the job, but then I want you to show me how to do the job, because I don't wanna be dependent upon you. So please don't come to me and say, I'll keep doing services for you for the rest of your life. I don't want that. So I want it to be affordable, I want it to be quick, and I want to be able to do it myself. That's what drives my decision-making as a procurement officer, as a C-suite who's gonna sign his name on it. So with that in mind, we built something called CareLabs. Can we move to the next slide, please? So CareLabs is a combination of wallet and a blockchain sandbox and an authoring capability in which you can author practically any solution you like, and it inherits the properties of the blockchain. You don't need to learn to write smart contracts. Because if you're writing smart contracts, you're playing at the wrong level, because the clients don't care about your smart writing capability. They want a solution, something called enrollment, discharge, admissions, billing, claims, payments, clinical coordination, referrals, pre-authorization. That's what the client buys. So if you can come to me and say, hey, Pradeep, I can give you a better eligibility system that's independently verifiable, that's infinitely scalable, and you pay per usage, not for the infrastructure, but for every eligibility transaction. I'm like, where do I sign? And then you say to me, we will try it out for $250,000. Maybe we'll only do eligibility for your individual claims, or only for your group claims, or only for your ultra-high net worth concierge care population. Doesn't matter. 50,000, 20,000, 10,000 patients or members, as you would call them in insurance business. And we'll roll it out. And then if you use it for a month or 2 or 3, and if you don't like it, I'll change it quick, quick, quick. And after 3 months, you decide, you go to the board and say, to roll it out to all the 5 million members, it costs $2 million. But you know what? We already tried it. And our big group insurer, a group client here, their employees have been using it for a month, and they don't mind. They like it, kind of, sort of. That's good enough. You'll get the contract. Okay? Because you're way ahead of the Deloitte saying, okay, Pradeep, next year's budget, could you please put in $30 million for innovation, because we're going to need that to help you get onto the blockchain. Kid you not. That kind of thing happens all the time. The big boys would walk into my office in October when our budget would be done and would ask me to put in 20, 30, 50, 100 million for a new technology they think I should be playing with. So they want to play with it with my money. They do that all the time. And they are doing me a huge favor. So let's stop talking about the art of possibilities and let's build something. Let me show you what's possible. Let's move forward, please. So what is possible with a blockchain in our world is to build a digital health solution where parties can talk to each other. Sound simple? Where people can talk to each other in a manner that I am not in the room. That's the key. Where a doctor and a patient can talk without the blue sticking their nose into it. And they need to know that, and they need to believe in that, and they need to know that technologically they are safeguarded. You can do the same thing between primary care and secondary care. You can do the same thing between hospital and pharmacy. You can do the same thing between employer and employee. You can do the same thing between nurse and practitioner. There are every single scenario in healthcare ultimately boils down to trusted communication between A and B. And the equally important is, for when A talks to B, C needs to get notified. Here's a simple fact of healthcare, right? I go see the doctor. The doctor has to tell the insurance company before I come see her, and tell the insurance company after I go see her, right? First thing is called pre-authorization. Second thing is called billing. Simple fact. Now, if we could just automate that in the blockchain where when A goes to B, C is automatically notified without C having to stick their nose into the A-B conversation, all kinds of problems go away. The number one thing that doctors hate in the United States is called pre-authorization. This is the bane of healthcare. I can't see my patient till you, the dumb CIO, approves me seeing my patient. Of course, I'm not the one approving it, but there's a huge call center I got sitting there that just does that. Right? And they're not evil people, they're just following the rules. You can put them on the chain, let the insurance commissioner review the rules, and let me get out of the middle. Because ultimately, you know the reason I have those people sitting in the call center? Because I'm responsible for the money that members contribute. Because if I don't do that, I go to jail. If I do that, I'm hated. I would love to be out of that game. I'll put it on the blockchain. You see, the use cases are many. Let me show you a list of use cases that make sense on blockchain. Can we move forward, please? Like 2 slides. Keep moving. Okay, here is a blockchain-based benefit plan. Okay, how many of you have health insurance? I hope all the hands go up. Okay, those of you in the US at least. Have you ever had the great joy of calling one of my call centers to ask for what your copay is, what your deductible is? How exciting is that experience, guys? Love it? Right? Why is that? Now, don't feel bad. I was the CIO of the Blue Cross. I called into my own call center. They didn't find me. They couldn't find me in the system. They said, "You're not insured, dude. Who are you?" So I'm like, "Okay, lady, are you looking at the blue screen or the green screen?" Because I know my system. She's like, "How do you know what color I'm looking at?" I said, "Because I know everything about your system. Tell me what screen you're looking at." She's like, "Green." I'm like, "You're on the wrong system. Log into the blue system. That's where you're going to find me." The system isn't evil. It's dumb. It's just inefficient, and it's set up. Not because somebody sat down and said, "How do we screw our membership?" No, I haven't met those CIOs yet or CEOs yet. What it is just set up inefficiently. It's chaotic. What I would rather do is to send you a token or a card or a digital certificate that says, "Here is your copay, here is your deductible." And you know what? When you go to see your doctor, give this token to her. It's valid. Because if it's invalid, it'll disappear from your wallet anyway. So the doctor can look at it and go, "Okay, I got the digital token. I don't need to call insurance company." How simple is that? You know how much money that would have saved me? $2.3 million a year in call center costs, plus daily harassment by newspapers calling me, "You denied Grandma Joe. How dare you? She has cancer." I'm like, whoa, she's not even insured with us. She's insured with the other guys. But it's chaos. So, and this is not just US, guys. We all we wash our dirty laundry in public here all the time, but this is worldwide. Okay? We just tend to suffer the most from it. But this is a universal problem. So build a benefit plan system. Use the CareLab. Design a benefit plan model where I can enter in my name or my phone number or my plan ID, which nobody remembers ever, or your employer's number, and find your copay deductible, and then have the ability to send it to the doctor in PDF, email, or wallet to wallet, and have it tokenized so that the doctor can receive it, verify it to be valid. Nobody calls the beautiful insurance company because nobody wants to. Simple solution, saves millions of dollars for every insurer, millions every year. And you can charge for it, by the way. I'll be happy to pay you per eligibility transaction in any cryptocurrency you like, as long as the accuracy rate is over 99%. Let's move to the next one. Provider directory, very famous problem. We insurers can never, ever keep the provider directory up to date. We don't know which doctors have passed on, kid you not. You don't always know which doctor is still alive. So your directory is always out of date. We typically find out from the estate of the physician that the physician has passed on, so we go and update our directory. The lag between a physician passing on and us updating a directory is 90 days. Easy. So for those 90 days, those unfortunate souls are going to call their doctor's office, are going to get a very nasty surprise, and they're going to say, what kind of an insurance company is this that I'm insured by? Provider directory is a big problem. You can solve it. You can have every physician have a wallet and a token that identifies them, and have them update their own information. How simple is that? Why do you have to fill out a dumb PDF, 93 pages long, fill and sign it and send it to me once a year? Why don't you just go into a wallet, use your token, log in, change your address, change your phone number, change your working hours, because they change their hours all the time. I'm practicing Tuesday, Thursday, nope, change my mind. Monday, Wednesday, Friday, nope, change my mind. Saturday only, nope, change my mind. Not practicing at all. Fine, just update it. This is a big problem, but the problem isn't that the doctor can't update it. The doctor has to sign it and certify it, and we need to know what moment that becomes effective so that we can update the directory from that moment on. Liability risk if you don't have it right. So we send you big forms, you fill them out, they come into my call center, we scan them into imaging room, then we data enter them double entry, and by the time it gets into my database, it's 90 days have passed. You can make that on blockchain, because you know why I can't do it any other way, or better with blockchain? Because I have a record to protect me. When the doctor makes a transaction, there is a record in the chain that I didn't play with, that you can't accuse me of having tampered the data. Back to what Dina was saying. Next one, this is another use case. Every insurance company has a problem. Appointment management, beautiful problem. How easy is it to get a doctor's appointment or a specialist appointment? You guys have tried that? 100 days, average wait time for specialty care. Yeah, Norway, it's actually over 6 months. It's one of the best advanced healthcare systems, over 6 months to get specialty care appointment. But then at the same time, doctors think they don't have enough work. They don't have enough money flowing in. Revenue is a problem. They are working too hard, but they don't get enough revenue. You know why? Demand-supply imbalance. It's really that simple. There's something in the US called closed networks, open networks, right? You've heard the physician network thing. We started this beautiful journey 30 years ago. It was a disaster. Nobody wants to admit it. We decided that all insurance companies are going to build their own network. So we'll have a fixed high-quality physician group. Everybody has a fixed high-quality physician group. The problem is neither they are high quality, nor do they have demand-supply balance. You're a big insurer, you get 250,000 doctors. I'm a small insurer, I have 5,000 doctors. There's always going to be too much demand for pediatrician, not enough demand for primary care, too much demand for primary care, not enough demand for pediatrician. Forget the oncology and ophthalmology, always a chaos. So why are we building these networks? They don't make any sense. Why don't we actually open the networks and say every doctor can sign up if you have a medical certificate, and I'll give you a token that converts into a payment? We could blow the entire network model away and save ourselves probably $200 billion a year in ridiculous waste in network management. So if you guys want to take business solution to market, those are the real use cases. Not the art of possibility, but the pain we feel today, where $4 trillion a year go, and $1 trillion goes totally to waste. We all know that every single healthcare dollar in the US, 25 cents if you are being very, very conservative, 40 cents if you are more of a realist, is just burnt to bureaucracy. That's your job as blockchain enthusiast, to take that revenue. I'll be happy to pay you, $400 billion if you can save the other 600. You just have to come up with solutions. That's your challenge, guys. Let's move forward. A few more examples of what you can do. Prescription management. Another dirty secret. Neither the doctor nor the patient nor the insurance company ever knows the drugs you're taking. Nobody ever actually knows the drugs you're taking. The only person who knows the drugs you're taking is you. Because Just because I wrote a prescription doesn't mean you're taking it. Just because I said you should have 3 refills doesn't mean you did the refills. Nobody else except you knows the drugs you're taking, along with the over-the-counter medication you're taking, except you. And how many times have you submitted your medication list to your doctor in advance of an appointment? Tell me, any of you? The most important element about your care is I need to know what the hell you're taking or not taking. So why are we not doing that? Because data is not trusted. Because by the time it gets to me through 3 different channels as a doctor, I'm not touching it, because I could get sued if I make a wrong decision. But if you submit a certified, tokenized list of your medication, and you, as part of submitting the list, say, I absolve you from the responsibility if I am lying, as a doctor, it's the same thing as me sitting across the table looking at you in the eye and saying, tell me, are you taking Tylenol or not? And I'll try to gauge if you're lying to me or not. But I will rely upon your words, because you cannot then sue me back. Blockchain doesn't need, it replaces that need. I can just trust your fully stamped drug list. And the moment you do that, I can do all kinds of things before you show up. You know what? I can actually probably save you 2 primary care visits a year. Now, your copay might be $25, but in the insurance company, that's $500 saved. So I would sponsor that all day long, if you can show me a prescription management system that is patient certified. Let's move forward to the next one. Wonderful problem in healthcare, billing and copay. I think we'll skip it. I'll just say it's a royal mess. What we want to avoid ultimately is we want to actually build a system where insurance companies don't have to adjudicate a claim. Here is another fact about insurance. 92% of claims I don't need to look at. They're going to fly right. They call it straight-through processing. I couldn't care less if you send them to me or not, because I would pay you the flat rate anyway. 92 out of 100 encounters that a doctor bills an insurance company do not have a variable rate to them, which means I don't need to look at them, which means I could have paid them with a token before the bill came to me. I could have given you the token to give it to the doctor, and they could have gotten paid real time, and they would have been happy, and I would have been happy. Only 8% of the claims in a typical insurance plan need to be looked at. And out of that, only 10% of the claims I look at actually should have been looked at. Yet we spend ridiculous amounts of money. You know how much does the adjudication system cost to build? To install a new adjudication system right now is a $500 million problem. And we do it every 5 to 6 years. And if the CIO gets it wrong, that's when your job goes. That's when your neck is cut off by the board, because that's the one you don't screw up. So it's a nightmare for every C-suite to install a new adjudication system, because you're going to screw it up. It's very hard, and you're going to get fired. All right? And the job number 1 in most organizations is to keep your job. So nobody wants to do it. So if you give them a solution to do straight-through payment rather than straight-through billing, a lot of insurers will talk to you. Next one. Medicaid spends billions of dollars in transportation subsidy each year. If you are too poor to go to the doctor, you also are too poor to take a taxi to the doctor. So we give you vouchers. And those vouchers are typically traded in the black market for cigarettes. And you skip the doctor's appointment because the voucher sells for $8. It's a $20 voucher. And you're like, forget the doc. I'll just buy another bottle of whatever. Lots of waste in Medicaid. Transportation could be digitized and tokenized. You could go bid on it all day long. Every state issues transportation contracts every 3 years. It's 150 contracts. You can do the math. But 10 to 12 are up for bids every year. You can tokenize this thing all day long and save them ridiculous money, billions. We're not talking a little change here. Okay, let's move forward. I'm just giving you what is the market need, not the art of possibility. I'm challenging you to pick one of these solutions, build it, go bid it. Because there is money every year circulating through these contracts. Don't look for use cases, look for where the money is getting spent. And then go do it. And we have the tools to do it. So here is just a list of blockchain-enabled business processes you can automate today. Appointments, admission management, authorization, referral, also pre-auth, your favorite topic, care coordination, case management, claims. All of these have immediate usage of something called trustworthy ledger. It's not blockchain they're buying a trust ledger. They're buying something that they know they can trust, and the court will say, yeah, this wasn't tampered. Nobody came and altered this. This is the factual data. So how do you do it? We have outside the sign-up sheet, CareLabs, sign up. You can either be a free member or you can be a paid member, depending on how big your organization is. We'll give you tons and tons of support and education. We'll give you opportunities that we already have that you can start authoring stuff on. We have pharmaceutical clients waiting for us to author cards. We don't have the time. We don't have the time to build everything for everyone. We have people calling us from Peru and people calling us from Panama City, and we have people calling us from Perth, Australia. We need people who are actually ready to get up and start implementing solutions. We'll give you the tools, we'll give you the education, the rest is up to you. The market is vast. I'm a former procurement executive of big systems. I would love for this organization and this blockchain enthusiast to get up and come to me with real solutions. And I've given you a huge list. Take your pick. Let's get started.
Do you have time for a few questions?
Absolutely.
Anyone have so many questions? I mean, the question that I first have is, how difficult is it to learn to use this, to find a solution, and how would one go about testing it to see if it actually accomplishes what you're designing it to do?
So that's a really great question, because for me as a buyer, I need to know you've tested it, but more importantly, I need to test it, right? So everything in the blockchain world can be tested through, obviously it's an open fabric, right? So it's only a matter of who do you give access to. So in our world, the Care wallet is what you tell them to download, and you give them a code, and that code connects them to your cards, and they play with it. And if they don't like it, they'll tell you right away, this card doesn't work, it's too complicated, the patient won't understand that. You change it again, republish it on the chain, and 2 minutes later, they can test it again. And more importantly, they'll say, no, I want to give 50 patients in my control group, all of us have our control groups, let them play with it. And they will play with it for a week and they'll tell you. So testing has to be real time, it is, and it needs to be as scaled as I want as a buyer. I may want to test with 5 members or 5,000 patients. You can just say, okay, fine, open up the access, we'll give you that many more codes, and off you go. So now in terms of building, to your first question, depends on the card complexity. Because everything in our world is a care card. We've basically used the analogy that let's make healthcare as simple as playing with a deck of cards. Not that simple, but the idea is I can send you a card, you respond back with a card. And that card has permissions, rules, authority, value, and when you send me a card back, that card has permissions, rules, authority, and value. And doing that, I can do anything, right? So building a card can be as simple as a day or a week, but that's about the window.
And what kind of technical experience do you need to have?
Domain expertise is the most important thing. It's not the technology. Technology has been abstracted. The most you'll have to learn is how to a scripting language level skill. So in my world, I would say that my analyst team, my business analyst, my system analyst, if I have to get into my IT, my core IT, we are way off base. Because those guys I don't touch. Right? They're not people that I can afford to just deploy. But my BA analyst, system analyst, yeah, I'll deploy them all day long. So my client wants to hear from you that their analyst is all you need. I don't want to hear from you that you're going to come in, you're going to talk to my DevOps and my IT security guys, and I don't want to do that. And the moment you touch that, I'm into a big, deep black hole of cost. So if you can come to me and say, give me your essay, BA, and I'll go author whatever your BA tells me, I'm in. So that's who you were talking to from a client perspective, just the business analyst.
And what are the compliance or regulatory considerations one has to have?
A lot. 3 basic ones. Who, identity of the person, what they're doing, is that legal, and what's the payload, what data is moving, right? And that needs to be configured in each card. Each card defines the sender and the receiver. Each card defines a consent attached to sending and receiving the card. Each card defines a payload. So we've abstracted down to that very basic construct. Okay. So if you do that, you will meet HIPAA, GDPR, high-tech, I will get you through a Stark, whatever. Because end of the day, it's all about who said what to whom and why, and was that legal, and did you send the right data, and did they receive the right data, and do I have a ledger to prove it?
And the IP that one creates when they use this platform to create something, who owns that?
It's public. So one of the things that we have done is we have flipped it. In all systems, logic is hidden and data is visible. In our world, data is hidden, logic is visible. When you write a card, you publish in the chain, your client can audit that. And they can say, yeah, that card is and you can give it to your insurance commissioner and say, please audit it. I'm not doing anything bad here by recommending 3 H1C checks a year. It's according to the ADA guideline, and it's right there in the code. You can look at it. So in our world, cards are public. You own the IP, but it's public. The author owns the IP, but it is auditable by anybody who is given access to the network. The whole idea is that when you bring me a solution as an insurer, or as Medicare, or as Medicaid, or as a clinical hospital system, whatever role I'm in, I need to be able to get some third party to approve my system so I'm not liable, right? I have to disassociate myself from the system. Typically, that happens today by hiring Deloitte to come in and audit my code. $2 million easy to do that, and we don't want to do that. So you publish the code on the chain, the logic is on the chain, let the community audit it.
Perfect. Yep. Thank you very much. Thank you. Oh, please step up to the microphone.
I'll repeat your question. Go ahead.
Okay, please repeat it, because I work for the mayor of the state of New York.
Mm-hmm.
And we're looking for every which way to just make things easier.
Mm-hmm.
Right? Like you would say, accessible and easier. So how hackable is this thing? Because we don't want
Yeah. So
we don't want like my mother to lose her phone or her card, and then someone can use her information because they have done fraud with her insurance in a hospital.
Sure.
Without really taking her identification to confirm that was her.
Yeah.
So I want to avoid something like that.
So I'll repeat the question. So what's your name? Sorry.
Denise.
Denise works for the mayor of the city of New York, and the question is how hackable is the system, because we don't want to be on the front page of NYT for the wrong reasons, and you want to make sure that the elderly population knows how to deal with it, right? And grandmother friendly. And that's a very good question. So, it's a broad question, but in a fundamental solution statement is the following. We need to disassociate the identity of the person as a human being from the identity of the person inside your solution. So when I participate in a state-sponsored network, pick one. You want to build a education network or a transportation network, or you want to do wellness network, it doesn't matter. Whatever the purpose is clinically you are trying to achieve. What you can do is you can allow people to enter that through their wallet, which is the only way they can enter the network. The wallet will only share the minimum necessary information in joining the network. So if you remove the requirement for me to tell you who I am, other than the fact that I'm a resident of New York, my age and my gender, then you don't need any more information for that service to be delivered to me. The wallet will hide the rest anyway. And the only thing I'll give you is a token, a digital handle. And even if somebody finds my digital handle, they can't trace it back to my identity. All they can figure out is they have a handle of a 50-year-old male in New York City. They can't do much more with that. And the data isn't attached to the handle anyway. The data is encrypted in a node, which they would have to hack using the same power as if they were hacking the whole chain. So even if you break a single node for a single patient, every other node is still the same computational power. So the juice isn't worth the squeeze. You don't know who you're hacking, and it's very expensive to hack. So how do you know who to hack? So that's why it's much safer. There are other techniques like encryption in flight and encryption at rest, but those are technologies that are pretty well defined. But fundamentally, you want to try to isolate the user's identity from the participant identity. And if they hack the network, they don't get to see anything else. They might know that somebody in New York has diabetes, but they don't know who it is. Right?
Perfect. Thank you.
Yep. Thank you, everyone.